muscles of the back side. The first muscle is the trapezius. Its origin is external occipital protuberance. Then the medial 1/3 of superior nostril line, ligamentum noce, spines of C7 to T12 vertebrae. It inserts into lateral 1/3 of clavicle, medial margin of acromion, superior margin of crest of spine of the scapula. The nerve supply to this muscle is spinal accessory nerve, C4 spinal nerves. The actions of trapezius muscle is it elevates the scapula, retracts the scapula and depresses the scapula. The next muscle is latissimus dorsi. Its origin is spines of T7 to T12 vertebrae, thoracolumbar fascia, iliac crust, lower 3 ribs, inferior angle of scapula. Its insertion is this muscle inserts into bicipital groove of humerus. The nerve supply to this muscle is thoracodorsal nerve, C6, C7, C8. The actions of these muscles are adduction, extension, medial rotation of the arm. Scapulae. Its origin is transverse processes of C1 to C4 vertebrae. It inserts into medial border of the scapula between the superior angle and root of spine. The nerve supply to this muscle is dorsal scapular nerve, C3 and C4 spinal nerves. Its action is that it elevates the scapula. It does the medial rotation of the scapula and tilts its glenoid cavity inferiorly. The next muscle is rhomboideus minor. Its origin is lower part of the ligamentum noce, spines of C7 and T1 vertebrae. Its insertion is base of triangular area at the root of spine of the scapula. Its nerve supply is dorsal scapular nerve, that is C5 nerve. The action of this muscle is retraction and elevation of the scapula. The next muscle is rhomboideus major muscle. Its origin is spines of T2 to T5 vertebrae. Its insertion is medial border of the scapula from root of spine to the inferior angle. The nerve supply to this muscle is dorsal scapular nerve, that is the C5 nerve, and its action is retraction, medial rotation and elevation of scapula.
The next muscle is deltoid muscle. It originates from the lateral 1/3 of the clavicle and from the acromion process and from the spine of a scapula, and its insertion is still deltoid tuberosity of a humerus. And the nerve supply of a deltoid is axillary nerve, and its actions are it helps in a flexion and a medial rotation of the anterior fibers and helps in the abduction of the arm and extension and lateral rotation of the arm by posterior fibers. And the next muscle is supraspinatus. This muscle originates from the medial two-third of the supraspinatus fossa of the scapula, and its insertion is still superior facet of a greater tubercle of the humerus. And its nerve supply is a suprascapular nerve of C5 and C6. Its actions are it assists abduction of the humerus till 15 degree, and it is further assisted to continue by a deltoid muscle. Infraspinatus. It originates from the medial two-third of a infraspinatus fossa of the scapula. Its insertion is till medial facet of a greater tubercle of the humerus. Its nerve supplies the suprascapular nerve of a C5 and C6, and it helps in the lateral rotation of the arm. It originates from the upper two-third of the dorsal aspect of the lateral border of the scapula, and its insertion is still inferior facet of the greater tubercle of humerus. Its nerve supply is an axillary nerve, and its actions are it helps in a lateral rotation of the arm. The teres major. It originates from the inferior one third of the dorsal aspect of the lateral border and the inferior angle of the scapula. Its insertion is still medial lip of the intertubercular sulcus of the humerus. Its nerve supply is a lower subscapular nerve of a C5 and C6. It helps in a adduction and a medial rotation of the arm. The subscapularis muscle, which originates from the medial two-thirds of the subscapularis fossa of the scapula. Its insertion is still lesser tubercle of the humerus, and its nerve supply is the upper and the lower subscapularis nerves of a C5, C6 and C7. It helps in the adduction and medial rotation of the arm.